what's going on, um, you know, observing it, checking it, any swelling or whatever, make sure to do the palpation, finding out, lateral malleolus, and usually was it, just checking for that was the talofibular ligament is right up here, for the anterior and then posterior aspect of it right here, and then in the calcaneofibular ligament right down here. And then on the medial aspect there is, there's a deltoid ligament right up here. Spring ligament is, what you want to do is you want to find the talus right here. Let's see. Let me just show you guys here. Bring this up a little bit. Yeah, good. So what you want to do is you want to find, medial malleolus right here, and then find the talus right here by moving the foot inversion and eversion, and then that's the talus right here, and then coming down, that's the navicular right here. So inside the navicular, deep to it, there's a sustentaculum tali, and then also that's where the spring ligament is. So just be able to kind of palpate it and see. So for the ankle, what you want to do is the first thing is the range of motion. So make sure to use the goniometer again. In the neutral position right here, that's the, starting from the zero. A lot of times with the dorsiflexion, they don't go much, but it's probably like if it's like about 20 degrees, so it might go. And then from here, you want to kind of bring it down. So let's look at the side. So let's see. So here, so in the neutral position starting from here, go ahead and do the dorsiflexion, bring it up, and it's, could be a 20 degree or so. And then going to the plantar flexion, you can look into about like 50 degrees or so. And then you want to probably do eversion and inversion. That's going to be a little bit tricky. What you want to do is that you want to actually have it in a flat surface right here and keep it in one of them, and then do the, so if you're going to do eversion first, then do the eversion right here, like how much degree. This will be a full foot eversion. It should be like about 5 degrees or so. And then it's neutral position, and then do the inversion. So do this way, and then that's another 5 degrees or so that you're checking. So you want to kind of check it from the top. And then there is the adductions and adductions and abductions and adduction. So what you want to do is from here, you want to just checking for how much of the adduction and abduction, checking for how much. Just don't worry about abduction and adduction. Just make sure to do the inversion and eversion, dorsiflexion and plantar flexion. And then from here, let's see. Make sure to kind of palpate and just checking for everything. First thing we want to do, we also talk about in the class, is the Hoffman's test. So go ahead and lay down. So for the deep tendon, deep vein thrombosis, what you want to do is that you want to check it. Just bringing the foot like up right here. Just kind of bring it up and up. And then a lot of times you want to squeeze it down here. So this will be Hoffman's right here. Next thing you want to do is that you want to check it for the circumferential of the leg. So make sure to kind of get the tape measure, just check, make sure that it's not swelling up or also showing up any of the atrophy or anything. Next text that you want to do is the Berger's test. Berger's test is like raising up right here about a 45 degrees or so. Holding it, some of the textbook was, oh, it doesn't show on a, let's see. Right up here. So I'm going to go up here. What we're going to do is we're going to raise it for 45 degrees. Hold it for like 2 minutes or so. Some of the textbook will say, dorsiflex a little bit. So let's see. Right up here and dorsiflex it. No. Up, dorsiflex it, still not good. Alright, then after this, what you want to do is to bring it down and then ask the patient to sit up and then just swing the leg into the side and then just checking for the coloration of the leg. Should have the good feeling like, within a minute or so. Like actually less than like maybe 15 or 20 seconds, you should start feeling it, seeing it, the changing the color. So after this, doing the burgers, so make sure to check for the dorsal pedis pulse, just checking it, and then also checking for the posterior tibial pulse. And then since you're on this area, what you want to do is that you can check, something is going on, okay, okay, let's bring this one. So what you want to check is that you want to just do the toenails, just kind of striking it and finding out what's, any sensation going down the bottom of the foot. And then lateral instability test, go ahead, lay on your back. And then here, just kind of checking it, instability, just bring it. Actually, it's better, let's see. Here. Let's see. It's better probably doing this way and checking it, lateral instability right here. And then medial stability test right here. And then anterior drawers, so make sure to hold it here and then pull it like anteriorly and then push it down posteriorly. Translation test is basically just having it holding on the tibia and fibula and just move it opposite direction like this, just checking it, how much movement is there, down and up, down, up. And then Moulton's test is basically squeezing it on the side right here and then just squeeze, and then a lot of times the patient will notice some pain. Motion palpation. So what you want to do, the first thing is dorsiflexion. Make sure to check the talus, how much is moving. You can give a little traction to it. Make sure to compare right and left. And then from here, what you want to do is to find the navicular and put the navicular. So first find the talus right here. Find the navicular, push it up and down, up and down. And then from here, you want to go in the cuboid. So on the 5th metatarsal in here, that's the cuboid. So push it down from dorsum to plantar, push it down, and dorsum to plantar to dorsum. Just kind of see the motion of it. Cuneiform is usually from navicular, just first in between the metatarsals and navicular. So just kind of check, pushing down, dorsum to plantar, plantar to dorsum. And then from here, I included neuro exam, so deep tendon reflex. Make sure to do some of the deep tendon reflex. Ask the patient to sit up and then have the leg down. So deep tendon reflex, first thing you can do right here, you can go boom. Usually for the L4, 5 is the medial hamstrings, S1 down here. If the patient is not able to do well, then do the Gingerasic sign that asks the patient to pull their hands. Yeah. And then what you can do is you can tell them to do a 1, 2, 3 and a pull. So 1, 2, 3, pull. And then that will distract it. If that's not enough, then ask the patient to clench their teeth with 1, 2, 3. 1, 2, 3, pull and clench your teeth. And a lot of times that's making it distract it a lot more. And then after that, you can also do the Babinski. So since you're here just checking it, Babinski, it's going to flare out if it's positive. And then also do some of the vibration tests. So go ahead and close your eyes and then put this on. Tell me when you feel it. Feel it. And then tell me when you stop feeling it. Stop. Okay, so that will be good to just checking vibration. Navicular drop test. You can just bring the sheet of paper and then check the way the navicular bone is. Let's see. So what you can do is here, coming here, find the navicular is, just mark the way that it is, and then ask the patient to stand up. Don't move the leg and stand up, and then check it how much the navicular is dropped, and then you want to measure it how much it is. You can use the navicular drop test card, or you can just do it with the regular paper. Thompson test. Go ahead and lay on the stomach. And then basically simply just checking for that Achilles tendon, so you just want to squeeze it. If it's complete tear, it's not going to dorsiflex. Alright, let's see. So just you squeeze it, and you can see how much of the dorsiflexion is happening right here. Right there. Okay, that's it.